Hey Doc, I am back with another wonderful guest. I am so excited because she has had me on her podcast twice, and I am so grateful that one of my clients was like, "Hey, you should have her on yours." And I was like, "Yes," because she is amazing. She is Dr. Amy Vertrees. She is a board certified general surgeon. She is an Army veteran. She is an author, podcast host, the founder of the Boss series. She is all the things. And I am so excited to have this very new, fresh perspective so that you can feel a little more seen and a lot less alone, as with all of my guests. And with all of those things, she is also a mother, just like you. So, welcome, Dr. Amy.
Thanks, Dr. Toya. I really appreciate it. I, of course, enjoyed having you on the podcast. You offer so much wisdom. So it's really an honor to be included on yours. And so thank you so much.
Yes. All right. So, I want to take it back because I very recently found out that you were a veteran. I think it was Veterans Day last year. I saw a post of yours. So, tell me about that decision to enter the military.
Yeah, it's a great point. I joined the military in the year 2000. And how it works was I was looking around at medical schools and I was in Florida, and none of the Florida schools really appealed to me. So I remember picking up a book, like a Kaplan book or something like that. And they described the school that was the best kept secret. And I was like, tell me more. It was the Uniformed Services University of the Health Sciences, the only military medical school we have. And we call it USIS for short. And if you haven't heard of it, you're not alone. Not many people know
Right.
about it. I know, right? I think it was established in like 1974 or 75, something like that. And it was 74. And it was a really great school. My dad was in the military, so it wasn't really a big stretch for me to consider it. So having been raised in the military family, it was a kind of a way to honor my father's legacy when I was, following a different path because he was not medical, but the military part really appealed to me because he was all in when it came to the Army, the leadership, the opportunities, and good moral fiber, all the things that were really great examples for him. And so it was really kind of an honor to his service, but doing it my way.
Yeah, that is beautiful. How I got little goosebumps. So he was in the army as well.
He was for 25 years, and he went to
Wow.
Vietnam, all the things when the Army was not simple, and
Yeah.
had a really strong career and great mentors. It was a really great experience for him.
Yeah. Wow. Okay. My husband is ex-Air Force. He did 10 years there. So I met him at the end, which I'm grateful for because I am grateful for his service, but I was not signing up to be a military wife. But I know it would have been a different experience for you having, be your entire childhood. So were you already married at this point?
I was married and, initially I did not think we were going to have kids. It just
Hmm.
didn't appeal to me. We were married for 10 years before we had kids. So,
Wow.
I went through all of medical school, and it wasn't until residency that I had my first child. And it was research year that did it. And like, they let you out of the grind and the rat race, and you're like, "Oh my gosh, we could have, like, hobbies, and there's this whole world out there and all these other things." And, I'd heard it said before that a lot of people who initially don't have children basically have their career as a child. I mean, this is where their focus is and their priorities are, and once you reach some stability within your career, and start to realize there may be more to life in the career, and that's pretty much what happened to me is I started realizing I can actually have this life I never actually even considered that was going to be for me. And I'm really glad that that worked out that way because my husband and I were married for 10 years. And so we had a really good bond and understanding. So when kids came along, as you know, it changes dynamics for everyone, and as each child comes along, it changes dynamics, but
Yeah.
for us, that's how it worked out. I think my career was first, and once it became stable, it seemed more reasonable to try.
Yeah. Wow. I have so many questions. So do you mind sharing how come you thought you wouldn't have kids? Like, was that always the case, or was it because of medicine?
It wasn't really a conscious thought. It was not a desire. I did not feel anything compelling about it. I couldn't envision a child for myself. And I really had no concept of how it would fit in my life. And it wasn't like a absolutely not. It was kind of a very bland decision of like, yeah,
Yeah.
I'm not going to have kids. And
Yeah.
it wasn't like an adamant, and it wasn't a it was almost like neutral, in fact.
Yeah.
So, so much so that I'd said it, and everyone kind of believed me that my mom was the first one to go like, "What? You're gonna have kids? What happened?"
Well, I'm glad it wasn't that she was pressuring you, so that's good. And I love that you brought that up because that is a perspective that people don't hear a lot. And it's very similar to how I was. You usually hear people like, oh, I knew when I was a child I wanted to be a mother. And then it's like, absolutely not. I don't want to do it. But there's this middle ground where it was just like, you know, we'll see.
I'm very ambivalent about it.
Exactly. Exactly. Thank you for making us feel seen. And it doesn't mean that, because you tell people things like that and they're like, oh, you're lying. You don't know. It's because you're single, like if you were or whatever. And it's like, well, no, this is just a variation of normal. So I love that you shared that. So when you decided it was 10 years, which is great. I feel like that's such a great foundation to know who you are as a couple before kids. What was the transition like once you did have the first one?
Well, I think it's like most things. Once you make the decision, I was all in, and it almost like a switch flipped. It didn't occur to me before, and then all of a sudden, like it was kind of like we were driving to Florida for a vacation, and it was like 16-hour drives. We really like to drive, and we were just
Wow.
having this conversation, and then it just kind of came out. I was like, at first it's like I don't know, like, do you think we should? Like, I mean, yeah, maybe. And then that was the first thought that occurred. And from then on, it was like, all right, well, we'll do this. And even then, it wasn't like a pressure thing, which was kind of nice. So it's nice to have something that would be nice, but also not mandatory. So there was really no pressure around it at all. And then from then on, it was all right, well, opening our eyes up to a new possibility of the future that we hadn't looked at. And so it brought a little bit of excitement, much like anytime we pivot in our life and say, I'll try this, and you get excited about it. And it wasn't like I missed it before, I needed it now, but it was a pivot and it was exciting. And so that part really just kind of transformed something that I'd never even considered.
Yeah, that's amazing. And where in your military career were you? So you did residency in like, how does it work in the military? Tell me
Yeah,
about that.
so it depends. Um, when you get accepted to USIS, you have to be able to be admitted as a commissioned as an officer. So you have to be first accepted into the military. I think you first get your medical school acceptance, then you have to make sure that you are applicable or like able to enter into the military. Then you get commissioned as an officer to join the school. So we
Mhm.
start day one as a second lieutenant or an O1 officer in the military. So I had 4 years when I graduated medical school, and then 7 years, I'm sorry, 6 years of residency, and then 7 years payback afterwards.
Mhm.
And it's a really great deal. It's a phenomenal school, great education. You get all the ranks and pay and benefits of being an
Mhm.
officer in the military. And so we had to wear uniforms, which was not a big deal at all. And then we had field training exercises, and those were really great too. It was just a really great experience to be a part of the military in that way. And some of our experiences, we got to actually interact with real people in the military. You don't really feel like you're really in the military,
Yeah.
but then we would go on these field training exercise with the Marines and things like that. And you starting to get appreciation for the small community that we actually support. And so I got 4 years in medical school with these training exercises. And then in residency, I was at Walter Reed for the heights of the war. So when I joined the military, September 11th hadn't happened. That was my second year of
Right.
medical school. And so 6 years of residency at Walter Reed, we saw the heights of the wars of Iraq and Afghanistan. And so every Tuesday and Sunday, we would have war injured come in, and we really had a phenomenal experience in learning a lot about trauma. And I did a lot of trauma research at that time too. It was just fortunate or unfortunate, I should say, that I was there at the time when there was such a heavy war burden.
Yeah. Wow. Wow. So when was the decision to have the child in relationship to the war?
Oh yeah, to answer your actual question, so
Fine. I was so enthralled. It's fine.
our research year was in our fourth year. So the 4 years of medical school, 4 years of residency, and then a research year came about. So I was pregnant during research year and ended up delivering in one of our senior resident years, so our PGY 5.
Okay. And knowing that it was at this time, because it hadn't computed in my mind before, did the fact that the war was going on affect your decision? Was that like, yeah, maybe we should wait?
It's a good question. At the time, uh, the conflict with having a child in my residency was one that most people can understand. I was going to inconvenience some residents, and I remember, I mean, as soon as that like second line hit, I talked to my program director very, very early on, and honestly, it was really frustrating that there was no accommodations made. It was somehow on me to make these accommodations. And in fact, actually, I have a really funny story about that. I was on the CT surgery, vascular surgery service. I was on call for them the day that I had some complications. And so I went to the doctor that day. I was still on call for vascular. And he said, "You're getting admitted today. We're getting induced today. And, this is happening." I'm like, "Oh, okay. Well, can I finish clinic first?"
Right.
Yeah, truly. And so I was on call, and ironically, the, OBs called and said that we have this patient who has a PE, and you're on call, and I also know you're on labor and delivery, and I was like, "Just give him
Yeah.
Wayfair Slovenox and call the attending directly."
It's like, yeah, it's not me.
But, still, as all of us, trying to not bother other people,
Yeah.
and, I was on the CT surgery service, so I asked the junior resident to, I was giving away cases left and right because 'cause I'm like, 9 months pregnant, and the on the CT surgery service, the thoracic guy liked to do everything open, and it was long, and those are really hard, and so I was just giving away cases left and right.
Yeah. Wow. Wow. Yeah. So during the pregnancy, did you like how did you handle it? Being that pregnant with in that type of environment?
Well, but like a typical surgeon would, so like, the first trimester was just, ill and, like, whatever, it wasn't bad, but my second trimester, I was 5, 6, and 7 months pregnant, I think, when I was at shock trauma in Maryland, and that was, like, an intense rotation, like, this one of our more intense ones, so every 3rd day we were on call, and, we are just sort of heroic. I remember one of the attendings saying, like, "Do you wanna sit down for this?" Like, "No." It's, like, very obstinate, and,
Right.
so I, honestly didn't take care of myself as we don't, because I didn't want people to have an impression of me. I wasn't really conscious at the time, but looking back is
Yeah.
pretty obvious. And so when someone offered me like some accommodation, I was very determined to say, no, I will do
Right.
everything that everybody else does. But on the bonus side, we were on call every third day. It was during the summer in Baltimore, and that rotation is intense. So we would order like milkshakes every day. So I had a milkshake every third day, and any medical student that was on, we had free access to ultrasounds. Like, anyone want to see a baby?
That
I
is
can,
hilarious.
I can tell you, ultrasounds every third day do not seem to hurt babies.
They don't. And that's thank you for saying that because some people are like, oh, we don't know what will happen. Nothing. Nothing will happen. That is hilarious. Okay. So you pushed through, didn't want people to think that you weren't committed, just typical for a female surgeon trying to prove herself in a male dominated specialty or any specialty for that matter. So okay. So you had the baby. Was everything fine with your birth? How did that go?
Everything was fine. She was 3 weeks early, so ran into oligohydramnios and ended up having a crash C-section. So
Oh,
apparently the placenta was only like 6 inches long and things like that. So between probably could have taken better care of myself. I imagine probably some dehydration things like that
mm,
too. Um, I do another funny anecdote. I remember being on CT surgery thinking whenever people call, I was like, "Do I really have to go? They sound fine over the phone." And every time I would move, I felt like my pelvis was breaking. So, but anyway, we powered through, and yeah, it was an interesting time.
yeah. It's funny that milkshakes are not that very hydrating. So, like, yes, you probably should have been drinking some water. That is a
Exactly.
typical triage summer. Everybody comes in for contractions. Like, have you been drinking any water? No. But yes, typical. Okay. So that crash C-section. I know for us as OBGYNs, it is one thing, but I want to get your perspective, like how was it for you to go through that as a doctor, as a new mom? Like, tell me about that experience.
Well, it's actually really interesting because, we think that we'll be like accommodating. We ask our patients, we do the whatever informed consent, and we expect them to, just sign and trust us. And for the anesthesia resident coming in saying, whatever, like, do you want this? And I'm like, I don't know, like spinal hematoma. And I actually was like starting to like freak out of all the things that are possible. And he had a lot of patience with me. And then he finally said, like, hey, look, we're kind of busy. This is like now or never. I'm like, all right, fine, fine, go ahead. So, that was one thing is, when you're in the position to accept an intervention, I was surprised at my own worry, and it helped me understand how patients get a little bit hesitant about things too, because, when rubber meets the road and you have to agree to something, all your fears come up. So that was, surprising. The crash C-section part, I mean, I knew about D cells and things like that too. So I kind of knew that things were kind of going on because they would like rush in
Yeah.
and they like look around and then rush out. And then so that was,
Right.
this can't be normal. Is this normal? And then
Right.
my
And
husband,
probably at the time when nobody was talking to you about anything. Well, I guess that still happens now, but they come, look at the monitors and then walk out and nobody says anything. It's like, come on, people.
I thought it was kind of normal for just a whole bunch of people to rush in at once, multiple times. And then the last time it was interesting. I didn't necessarily catch on to this. My husband did. So that one time that they came in, the surgeon was like taking off his ring and putting it away and things like that too. And then it was in like 5 minutes. I actually highly recommend it. I didn't have any time at all to think about it. It was like, oh, we're going? Okay, sure. Yeah, fine. So
That is a take I have never heard before.
I didn't have anticipation. I didn't have worries. All of a sudden, we're doing this. And 5 minutes later, it was done.
Right. And then I have a baby. Excellent. That is good.
Not bad.
I'm so glad that that was your experience. Okay, good. So, how was recovering after all of that?
And so I went home and we had like, this is like the difference between our thoughts about what's going to happen and what actually happens. So, we had the bassinet next to the bed and I'm like laying flat after my C-section.
Mm.
And, we have this like beautiful, like quaint, magazine cover picture of this. And so I lay down, the kid cries, I sit up, horrible pain. She hates the bassinet.
Right.
And from then on, I was in a recliner for like 6 weeks.
Wow. Oh, that's terrible. Okay.
So funny now.
I'm glad you laughed. At least you're not crying. So that's good. So, how many children do you have? I didn't
I
know.
have two now. Um,
Two. Okay.
but I do want to tell you about how terrible of a patient I was.
Oh my. Please tell me.
Okay, so as soon as they took my epidural out, I knew my Foley could come out. So I asked them to take it out, and they wouldn't. I said, "Can you tell me where I could find a 10 cc syringe?"
Oh,
And
don't be that patient.
I was totally that person, and I even dialed down my fluids and everything too. So
Wow.
I was a terrible patient. And then I asked
Yeah.
for a staple remover kit so I could take my staples out
No,
of.
you didn't.
Sure.
No way.
It's so
Did
they
you actually do it?
Well, they wouldn't let me. So
Okay.
I did still push back. I was like, "So what you're saying is you want me as a PGY4 to come in." Actually, I was PGY5 at that time. Come in and have the med student take out my staple.
I didn't think about it that way. Oh, yeah. Yeah, you definitely could have done it. Hmm.
All right. So here's the thing, though. I was nice and smug about all this, right? So I'm in there like as a first parent, or a first kid parent, and things like that. Everything's quiet, and all the things. Try to keep it all gentle. Well, you know what happens when it's a little bit dark? You do not notice that your child is turning orange. So I had trouble with breastfeeding and I did not notice it. And so when I did finally go to get my staples out, like I finally listened to them and they're like, have you noticed that your kid is kind of like not an okay color? Her bilirubin was 20 because
Wow.
breastfeeding was not working. And of course, everything was
Wow.
dark and I didn't notice it. And as soon as we went into like real lights, I was like, oh my,
Yeah.
maybe I'm actually
Wow.
this. Maybe I'm actually terrible at this.
No way. So was she crying a lot? Like, was she not getting enough transfer? What was going on?
No, no, just, the breastfeeding didn't work, and it didn't work for either
Yeah.
of my kids, too,
Wow.
so just despite trying really hard for 2 weeks. I tried really hard
Yeah.
for 2 weeks for that, and then finally just kinda gave up. We had to
Yeah.
be admitted, do the Billy Lights, all the
Yeah. Yeah.
things.
Yeah.
So
Okay.
that's the
And
first being a terrible
yeah.
mother.
No way. That's not, hey, I feel very strongly about that. Once you feed your baby, that's fine. Just keep them fed.
Yes.
So, what did that affect you in any way? Like, what relationship did you have with breastfeeding?
Well, I tried really hard, and we did the pump and all these, and I tried all these different things, and just for some reason, it just didn't actually come in, and
Yeah.
so, which I laugh about it all the time now. I mean, at the time, it was very distressing, and
Yeah.
like this was my first like I'm not achieving something, which is really annoying. And so that
Yeah.
was one thing that motherhood has offered is that, I think I'm right, I'm not. And I try for stuff and it doesn't work. And I was like, "Oh, is this what parenthood is? Is this like failure after failure?" And so this is fun.
Well, if you frame it like that.
But I joke about it now. Like I do a lot of as a general surgeon, I still see a lot of breast cancer patients. And
Mm,
so I always joke about it saying, I mean, I do this for a living. I couldn't get mine to work. So
right. Right. Yeah, it's good to have that perspective to relate to your patients a little bit more. So you went back to work, I'm assuming, after only 6 weeks, right?
yeah, so the way the ACGME worked at the time was they would allow you to have 4 weeks and you can use 2 weeks of vacation. So, I only took 6 weeks and it felt a little bit short, and it was a really hard actually because, my next rotation after that was pediatric surgery, and so there was nothing like leaving your kid and then seeing all the bad things that could happen to kids, and so that was probably the most traumatic. I would everyone kind of focuses on the pregnancy as the hard part. Well, the kid's with you all the time. Once you leave, like, once, like, the kid, your child is somewhere separate, like, you're always worrying. I was not really prepared for always worrying, and
Yeah.
then I go into an environment where I have very good reason to worry.
Yes. Yes, that is terrible. That's why I can't do peds. Like, who wants to see sick kids? That is, yeah. Do you think that there was a little sprinkle of postpartum anxiety that may have been undiagnosed, or it was just because of the environment that you were in?
I feel like I didn't feel, anything beyond what probably was felt like normal,
Yeah.
a little bit of anxiety and worry, but it wasn't all consuming.
Yeah.
I don't think I would have really honestly enjoyed pediatric surgery anyway, but having, a little bit of it hit a little too hard to see these
Yeah.
kids, and, it's probably a little bit too, unobjective in some of these
Yeah.
things too. So it was an interesting time, to have that rotation, so I was quite glad to get off of it.
I'm sure. I'm sure. So what kind of support did y'all have at the time? Is your husband a physician?
He's not a physician, he was working at the time, so the first time he was working a full-time job, but, was very flexible, and that was
Mm,
helpful. There was, only one time where we really ran into problems with, um, children, and that had to do actually, that was my 2nd child, but it had to do more with, deployment aspects and
yeah.
things.
Yeah.
So
So tell me about that. I know you deployed multiple times, but or
3 times actually. So 2 kids, 3 deployments. So,
wow.
finished residency 2010, and we were, actively, going through war times. The first time, we are not deployable when you're a resident. So my,
Mm,
first child was basically inconveniencing other residents, which everyone couldn't understand. My, 2nd child, it was a little bit hard because I finished residency 2010 with and, I had my first child in 2008. And I didn't want to get pregnant right away because you didn't wanna be that guy that looked like they were avoiding deployments. So I thought, we'll get another deployment before we would even consider, anything like that. So my first deployment was in 2011, so it's, right afterwards. And so my, oldest was 2.5, and all the deployments were hardest the month before. And that's as you're anticipating leaving
yeah.
and worrying if you're gonna come back. So that actually probably provided more anxiety and worry than anything. I felt a lot of pressure to make sure things were set up and, memories were made. And, there was a lot of pressure to make sure she could read, because I was
Mm,
like, if something happens to me and my husband, if she could read, I feel like she would be okay. So
yeah.
that first month is the hardest because you're not gone, the clock hasn't started, and you're really worried. And so once you leave, it's almost a relief. It's strange to say, but
Mm,
it's almost a relief because the worry is over, the clock has started, and you know that the countdown has begun. And that
mm,
was really, really helpful.
wow. And you all do long deployments, right? The army, how long do y'all deploy for?
Um, as doctors, it was a little less. So we would
Ah,
split the actual deployments. So most army deployments were 12 months long. So this one was 6 months. Now you typically leave, 3 or 4 weeks ahead of time for pre-training, getting all your equipment, things like that. And then afterwards, when you come back, there's like a redeployment and things like that too. So my first one ended up being, closer to 8 months.
ah, okay. And what was it like? I know you said there was a relief once you actually started, but what was it like being away from your child during that time, especially such a young baby?
I was really lucky in the fact that I, trusted my husband 100%. So we had a great relationship, which was great. And he really focused on um, making videos, and he would tag me on Facebook. And because Facebook was actually pretty easy to get, we had
Mhm.
Skype at the time. So it was almost every day I could talk to them or see her, So I didn't honestly feel like I was so disconnected. There were times, if someone was killed in the field, basically comms were down. You couldn't talk to anybody. So there were times like maybe a few days here and there where I could not talk to them, but almost always could see them every day.
Wow. Okay. And you're a general surgeon, you're not a trauma surgeon.
Mm-mm.
Or
In the army, you
and
are a
how
trauma surgeon.
that's what I was about to ask. I was like, it doesn't even make a difference once you're over there.
Mm,
I want to tread carefully here. Is that something that you're okay talking about or
yeah,
not really?
100%.
So how was that, apart from, having your child over here, being a trauma surgeon in this war, what was that like?
So in 2011, I was in Jalalabad, or J-Bad, and I was there in 2011. That's where the SEAL team got bin Laden. I was there at the
Mm.
time. We met the medical team, but we did not meet the actual SEAL team. We were there, O Dark 30 was at Jalalabad, and filmed was from there. So that's basically the environment that I was in. And all three deployments were a little bit different. This first one was probably as close to like real deployment as you can imagine. So not only was the clock starting, but you're significantly distracted with the job and events going on. Our base was attacked pretty substantially once, and a couple other times here and there. There's always the risk of green on blue attacks, which is the Afghan support staff attacking Americans. And it sounds terrible, but I think we didn't understand, and we were taught a little bit of this ahead of time, the cultural differences between us and Afghans. So if you insult someone, they are obligated to retaliate. So there's some cultural differences you have to be careful about. And there were a lot of times where our interpreter was talking like a long time to a patient. And I was like, hey, what's going on over there? Like, you guys seem like you're talking a lot. And he's like, I'm kind of talking him down. Y'all are, we had to be very careful about being respectful and mindful and things like that. I was pleasantly surprised that I did not have that much of an issue being a female over there, because, females are not necessarily considered equal, but they were very respectful, which was helpful. There was only one time where someone higher up in the Afghan military came in and gave a little attitude to one of our X-ray techs, who was also female. And said, she said, take a deep breath for the X-ray. And he said, I don't do what women tell me to do.
Well, damn. Okay.
Okay, don't take a deep breath. I don't care.
Right. Get a bad image. All right, fine.
Yeah, but for the most part, we try to be very respectful of their culture, and they were very respectful for us. And but that was certainly a risk. I mean, you look around saying, could these people turn on us? And there were a couple times there were some tense moments and things like that. So that was one underlying pressure. The medical aspect was very difficult. At that time, we were doing a lot of nighttime operations. So it was very difficult to decide when to be up and when to sleep. And it was February 2011, which was, I remember because my birthday was around that time. And I think we worked for like 2 weeks straight, like not really hard to tell what was up and down. And we actually had to, triage our time. And that was a real challenge. But so when I was gone, I It's been described before, and I agree. You basically put your family and the, home in a box, and you put it on a shelf. And it rattles every now and then, but for the most part, you're just there doing stuff. And it's very intimidating. Like at that time, I was doing neck explorations, thoracotomies, we had a pancreatic injury. We had someone who shot himself with his M16 in the abdomen. And we would get uh, a lot of times the Afghan folks, because they didn't have body armor, we'd have a lot of penetrating injuries. And then Americans were in like these big vehicles and had a little bit more of the big blast injuries, especially from below. So the injury patterns were a little bit intimidating. And to give you an idea what we have over there, there's I was there with two other general surgeons. So it was three general surgeons, an orthopedic surgeon. We were part of a full FST, so about a 20 person group. And then we were co-located with the Charlie Med group, which is phenomenal. They were the medical group, and we would get like whole blood. Like if we needed someone for a massive transfusion, they would do is like call over the speaker. We need this blood type, and you would have a
Yeah.
line of people, and we would have blood in our hands in 30 minutes. Um,
Wow.
it was a really remarkable time. The only thing we had there was X-ray and ultrasound, and sometimes our X-ray tech would be required to, guard the base and stuff too. So it was just interesting to get by a lot with the little that we had.
Yeah.
So no CT scanners, no laparoscopic stuff. So it was a stretch of all of our training, but luckily, I mean, I
Mm.
really felt like I had the best training.
Yeah.
At Walter Reed, and then shock trauma really prepared us a lot for it. We were on Dr. Scalea's team, and he's a phenomenal, well-known trauma surgeon, and he was always very, very kind and supportive for the military. And he knew that within a few, like within 2 years, we could potentially be in these situations. We were all by ourselves. So he let us, do hand sewn stuff. He really focused on a lot of the vascular stuff, and was probably one of the biggest um, advocates for our real life training, and really supported us with that too. So I really felt at that time that I was in the best position to help others.
Yeah. Wow. That is insane. I can't. So after experiencing all of that, and then you come home,
Mhm.
what was that transition like to come back home
It's weird. It's kind of like you put the deployment thing
in
in
the
the
box?
closet, and you shut the door, and you come back. And it was, I mean, and you really honestly just reintegrate into normal life, and then it becomes like a memory. And
Mm,
that month before, out of the whole deployment, is probably the month before you left that was always the hardest, because now you're living, and I understand now, with all the mind work that I've learned about, is that you live in your mind and you live in your worst case scenario before you leave. And then when you're in it, it's not so bad. I mean, actual
right.
real life is usually not as bad as we think. And then we come back, and now it's in the past. So it goes in the back of your mind. We at the time had a very heavy op tempo, which is, like deployments. And in that first deployment, I remember our consultant for general surgery for the Army sent us an email, because he's like, I just want to let you guys know what the situation is. We have 150 general surgeons in the Army, and 50 are non deployable, either medical or residents, and 50 are deployed. So y'all do the math. So we basically, every time we would come back home, we were on the countdown for the next time.
Wow.
And it's hard too, because like if you're pregnant, you're non-deployable. So there was a
Right.
little bit of pressure of saying that, if I am not deployed, someone is deploying for me,
Yeah.
and never really wanted to be that guy. But at the
Yeah.
same time, you also have to accept, well, you know what? Ain't getting any younger.
Right.
So
Yeah. How old were you for your kids when you had your kids?
35 and 38.
Okay.
Which, by the way, is listed on the record as geriatric pregnancy.
Yeah, we don't use that anymore. Sorry about that. It's advanced maternal age right now.
Yeah, love it.
Okay. So that is an interesting, very unique early motherhood journey. The second baby came when in all of this mix?
Yeah, honestly, that was the much harder one. So the
Mm,
first deployment, I knew I was expecting it, and it had everything all set up. She was 2.5, so she was relatively, she was excited about everything and everyone. I knew she was going to be okay. But the second deployment was hard, because I left my youngest when she was 8 months old, and so had not even started crawling. And that was really, really hard, because she transformed the most when I was gone, and felt like more of an abandonment than my oldest. And it was just, I just honestly just didn't want to go.
Yeah. Don't blame you.
Yeah. I mean, honestly, like looking back though, like the first, second, and third deployment, the third deployment wasn't terrible because I knew this was going to be my last. I was going to get out of the military afterwards. And in fact, I volunteered for that one. I knew I'd be set up for another one. So, in the desire to take a little bit of control, I volunteered for it just to make sure that I could start
Yeah.
planning for life beyond the military. Um, and it's funny how it works because they had a deployment at Kuwait. I was like, I'll volunteer for Kuwait. That's reasonably safe.
Yeah.
Anything could happen. But of course, what they did not tell me was Kuwait is like one step to Iraq, which is where I went.
Right.
Right. So, but at the same time, I knew another deployment was coming. So I was honestly really fortunate. Both our first deployment, we had a significant risk. The second deployment, not so much. I was in the Helmand province in the desert at Camp Dwyer, and that wasn't awful. And then my third deployment was in Erbil, Iraq, which is actually Kurdistan. I actually felt really, really safe there. But come to find out, like 2 years later, that they were significantly attacked. So
Wow.
you never know when you're in enemy territory what's going to happen. And we've had
Yeah.
an orthopedic surgeon, general surgeon killed, and a lot of people that had much, much closer attacks that could have potentially resulted in this too. So it's a
Yeah.
substantial risk.
Yeah. Wow. So I feel like you have a very unique position for this next question that I'm going to ask, but
Mhm.
I'll ask a free question. How old are
Mhm.
your kids right now?
They are 12 and 16 right now.
Okay. So you left one when she was 2.5, and then the other 8 months, that was the harder one.
Mhm.
Now, looking back and looking at the relationship that you have now, do you see like the effects of that early separation?
Nope. We have all forgotten. And it didn't, honestly, it did not take long to forget. And, I see people all the time worried about a night or two, things like that. Kids are resilient and they really, honestly, they're interacting with the world on their own. And we have the ability to maintain the relationship with them, even if we're not there. So one thing to consider is they have their own lives too, and I think that starts early on, having their own life. So I think definitely giving them the credit for being able to start navigating their own life and starting, kind of the letting go process, that we're there to support them. And the second has to do with mom guilt. We set them up and we are caring for them even if we're not there. And before my first deployment, and I did it for all three of them, I planned for gifts every month and I bought them ahead of time and basically kind of revealed it over time. And so planning to be front of mind for them over time. So even though I wasn't there, I felt like I had cared for them ahead of time. And
Yeah.
that part helped me a little bit too. But because we think because we're not in their face, we're not caring for them. But honestly, like I picked the right spouse, picked the right father, and
Exactly.
I planned it. That's a number one. If anyone takes anything from this, pick the right father of your children.
That is a word right there.
And he actually did a lot towards keeping me front of mind in front of them too. So, I mean, I think that the spouse can actually do a lot when we're away and saying, mom loves you, she's thinking about you. And, because really our relationship with other people are our thoughts about them. And so if we're offering them thoughts and consciously all the time, then we are maintaining that relationship. It doesn't have to be a proximity.
I love that. That is like one of my core tenets as a coach for physician moms is
Yeah.
to help release that guilt. Because you're right, we don't, I love how you said it. We don't have to be in their face all the time.
They don't, their face all and stuff, man.
And it doesn't make you any less of a mother. And if a lot of the things that cause this guilt, it's like borrowed guilt from other people's expectations and definitions of what mothers are supposed to be. But we are making our own definitions as physician moms. And definitely you had to do that as a military surgeon mom. And it was wonderful to hear about your story and your journey. I'm so glad we could do this.
Me too. And
Yeah.
without question, it has become such a distant memory. It was so remarkable at the time. But, the worst, truly, I want people to really remember this. The worst was worrying about it because you lived the worst case scenario. And looking back, it is like literally all forgotten. I mean,
Wow.
you have pictures and I have videos. In fact, the one 100% bright side of that is that we knew I would not be around. We knew that I would miss things. So we have a lot more pictures and videos than I think we would have otherwise. And
Yeah.
that is the gift that really, really we probably would not have considered at the time. And it's really important now because our kids are different people than they were before. Like
Yeah.
they're just different. And to have that memory of that time is probably the biggest gift of that, and so we never took it for granted, and that that is what we'll always have is the memories and realizing how important it is. As my kids now, I take lots of pictures now, and they find it all irritating, and I keep saying, "Trust me, you will appreciate this later."
Exactly. But pictures are the best, man. That's wonderful. You've given so much knowledge and wisdom, but is there anything else you want to leave our listeners with?
I think just really trust yourself. I think that I did trust myself a lot of the way, but, there's so much worry and uncertainty, and I think just realizing that you will come up with the right thing, that you are on the right track, that the discomfort doesn't necessarily mean you're doing something wrong. It usually is just awareness of that we have an important job and trusting ourselves and not adding any layers of harm and suffering and guilt to it is completely unnecessary. They don't need it and we don't need it.
I love that. I love it. Thank you, Dr. Amy. This has been amazing. And I want to have you just tell our listeners a little bit more about your podcast and your coaching, just in case there are any surgeons listening.
Oh, that's great. Thanks. Well,
Mhm.
I'm great. Thank you so much for having me on first. This is a real honor. I mean, I'm so happy to support your listeners and all. I have the podcast called the Boss Business of Surgery series, and this was filling in what I knew I needed, which is the lessons not taught in residency, how to deal with difficult colleagues, how to deal with complications, how to be more efficient in clinic, and how to navigate this job that we have and negotiate and advocate for ourselves. So, my podcast is highlighting other people like yourself and really supporting the mission that I now see is my mission, which is to elevate ADO as we rise, is to help others people. And it's this collaboration and network and support of other people, which is, honestly my mission. That's how the podcast started. I have a book called The Become the Boss MD, Success Beyond Residency, that follows a fictitious surgeon through her career, both from interviewing to career changes. I'll have another book coming out called Cutting Through Conflict, talking about dealing with difficult colleagues. I coach one-on-one, and I also have a group for female surgeons currently. So that's how I help serve.
Amazing. There's so many different ways. I didn't know that you had a second book coming out. She is absolutely amazing. So all of her information will be in the show notes. And make sure that you share this episode with another physician mom. You may not be in the military, you may never deploy, but all of these things are important for all of us as physician mothers because we're going to have to be away from the kids at some point. And it is good to have the perspective of a seasoned mother to give us,
Everyone will
the
be okay.
reassurance. Exactly. Everyone will be okay. So be sure to share, leave a 5-star review on Apple Podcasts, a 5-star rating everywhere else, and we will see you on the next episode of Stethoscopes and Strollers. Bye.